What do you do?
That's a good question.
What's a good question?
What I do. Try and be there for Jewish people and their families that are going through an end-of-life experience. Try and, when they're befuddled and confused, try and hold their hand and direct them and get them through their journey. Death is a mystery. No one, I mean, it's a cliche, but no one's been there and come back to tell us what it's like. We all have different perceptions. We get them from different places. If you're religious, you have a whole theology about it. If not, you've along the way have made some judgments or think you know what it's about. But then when you confront it, no matter how knowledgeable you are or how knowledgeable you think you are, you're confused and you're lost, and usually you're pretty scared.
It's enlightening for me as a rabbi to be in the room with a patient and their family during the last minutes of their lives. We deal with very, very serious times here, and families go through times of pain and suffering, and we as staff, we're exposed to all of it. But walking in the halls and in the offices and in the meetings of Jewish Hospice, Rabbi Bunny just brings his smile and his amazing sense of humor that just lifts us up.
I also think of like speed. It's like, hi, Rabbi Bunny, because he's always on the move. It's very rare you see him sitting still. He's always running, and it's always for Jewish Hospice.
Jewish Hospice and Chaplaincy Network tries to bring together all the resources in the Jewish community to help a family that's going through an end-of-life experience. And so we have social workers, we have rabbis, we have volunteers, we have people that know the inside of the healthcare system, care coordinators that could help you and guide you and hold your hand and not let go. Wherever you are, Jack, we're going to be there for you. We'll be holding your hand, and especially your dad, we'll be looking after him. When one of your rabbis walks into a room, he comes with a lifetime of experience of dealing with these things, and there is a comfort level that he comes and sits across the table with you, and he understands and he knows. We're incredibly nice stuff, more stuff than I heard while he was alive, all the nice things about your brother.
He was a really sweet guy, really sweet.
People liked him. People liked him a lot.
But you know what, he died the same way he lived. He did it on his terms, when he was ready. It drove everybody else crazy how he lived. But it worked for him, and that's how he lived. These are friendships that I have made through you that will be forever lasting in my life because they meant so much to me. I could not have done it without you.
No, I need the Kleenex. It's an honor that we're able to help, and you know how it's just, that's what keeps us going.
We bring so many things when we walk into a room without saying a word. You bring the comfort of Jewish tradition and also the authority of Jewish tradition. When people are dying, usually the family, even more than the person, is more concerned about doing things right.
Every Monday morning, our team gets together and we review all the patients that died in the previous week. And we review and see what loose ends there are and what follow-up we have to be doing, and what we think we did right, what we think we did wrong, what were some of the problems. Then we move to our new patients that we signed on that week, and we do an overall assessment. So we probably have seen 7 or 8 or 10 patients that have died, reviewed them, and maybe there's been 10 new patients. So the turnover is very, in our work unfortunately, is very consistent. It is pretty intense.
At that point in time, they're going to sit down with the doctors and decide what to do at that point. So we talked about the supportive care that we could provide. We talked about palliative care. They were very interested in palliative care.
There's probably no work that I'm familiar with. I've never seen anyone that could go to bed like I do knowing that you've helped people. It's a tremendous satisfaction from this kind of work. Jewish Hospice and Chaplaincy Network has been fortunate to grow in this community, and I thank every member of this community for allowing us to serve your families and any Jew that needs our help.
Our dad passed away when we were both 9 years old, and toward the end, Jewish Hospice and Chaplaincy Network was really there to support us and help us.
I hear these stories of life, of people's experiences, and I'm just amazed by that.
I've really realized what an invaluable resource they are to the patients and families that live in this community.
When my husband was ill, they were there. They made that end-of-life decisions much easier for all of us.
When my bubby turned 99, we called hospice We didn't know what else to do, and thank God we had Bunny Freedman's phone number, and he made everything happen for us.
We provide all these services free of charge to all our patients and families. The way we cover the costs of our team operating is that people make generous contributions to us because they want others to have the same service that they have. And that's our motto, no Jew is ever alone.
In the Jewish tradition, the first question was Ayeka, where are you? The answer was Hineni, I am here. The Jewish hospice, they are here. We are here.